Hi, beautiful people. Welcome to our channel. If you are new here, don't forget to smash that subscribe button and ring the bell to stay updated on all our latest health tips and tricks. Before we start, if you find this video helpful, please give it a big thumbs up. It really helps us reach more people with this crucial information. Vitamin D, often called the sunshine vitamin, plays a crucial role in our overall health. Our bodies need vitamin D to absorb calcium and phosphorus, essential minerals for strong bones and teeth. Vitamin D promotes bone health by helping the body absorb calcium effectively. This is particularly important during childhood and adolescence when bones are growing and developing. Vitamin D also plays a role in cell growth, immune function, and reducing inflammation. While we can get some vitamin D from our diet, our bodies primarily produce it when our skin is exposed to sunlight. When sunlight hits our skin, it converts a cholesterol-derived compound into vitamin D3. However, many factors can affect our ability to produce enough vitamin D from sunlight alone, leading to deficiency. Vitamin D deficiency is a common health concern worldwide, affecting people of all ages and backgrounds. It occurs when the body doesn't have enough vitamin D to function properly. While insufficient sunlight exposure is a major contributor, several other factors can lead to deficiency. One significant cause is inadequate dietary intake. Few foods naturally contain high levels of vitamin D. Fatty fish like salmon, tuna, and mackerel are good sources, as are egg yolks and some types of mushrooms. However, many people don't consume these foods regularly enough to meet their vitamin D needs. Malabsorption issues can also contribute to deficiency. Certain medical conditions, such as celiac disease, Crohn's disease, and cystic fibrosis, can impair the body's ability to absorb vitamin D from food. Obesity is another risk factor for vitamin D deficiency. Vitamin D is fat-soluble, meaning it gets stored in fat cells. People with obesity tend to have lower levels of circulating vitamin D because their bodies may store it in fat tissue instead of releasing it for use. Another cause of deficiency is age. As people age, their skin becomes less efficient at synthesizing vitamin D from sunlight, and their kidneys are less capable of converting it into its active form. Vitamin D deficiency often develops gradually and may not cause noticeable symptoms in its early stages. As the deficiency progresses, however, various symptoms may arise, ranging from mild to severe. One of the most common symptoms is bone pain. Vitamin D is crucial for calcium absorption, which is essential for maintaining strong bones. When vitamin D levels are low, calcium absorption is impaired, leading to weakened bones. Muscle weakness is another common symptom. Vitamin D plays a role in muscle function, and deficiency can lead to muscle weakness, aches, and pains. Fatigue and low energy levels are also frequent complaints among those with vitamin D deficiency. Furthermore, vitamin D deficiency has been linked to an increased risk of depression. Vitamin D has been linked to mood regulation, and deficiency may contribute to depression. Impaired wound healing. Vitamin D plays a role in the immune response, and a deficiency may slow down wound healing. Hair loss. Severe vitamin D deficiency has been linked to alopecia, an autoimmune condition that causes hair loss. Increased risk of infections. Vitamin D is crucial for immune function, and deficiency can make individuals more susceptible to infections like the flu and respiratory tract infections. While vitamin D deficiency can affect anyone, certain groups of people are at increased risk due to factors that influence their vitamin D levels. People with darker skin tones are more susceptible to deficiency. Melanin, the pigment that gives skin its color, acts as a natural sunscreen, reducing the skin's ability to produce vitamin D from sunlight. Older adults are also at higher risk. As we age, our skin's ability to synthesize vitamin D declines, and our kidneys become less efficient at converting vitamin D into its active form. Breastfed infants are another vulnerable group. Breast milk, while highly nutritious, is naturally low in vitamin D. Individuals with limited sun exposure, such as those who live in northern latitudes, work night shifts, or have mobility issues, are also prone to deficiency. Testing for deficiency, diagnosis, and evaluation. Vitamin D deficiency is typically diagnosed through a blood test that measures the level of 25-hydroxyvitamin D, the precursor of active vitamin D. Levels are generally classified as follows: deficient, less than 20 nanomoles; insufficient, 20-30 nanomoles; sufficient, 30-50 nanomoles. The results of this test help healthcare providers determine the most appropriate course of treatment. Regular monitoring of vitamin D levels is essential, especially for individuals at higher risk of deficiency or those undergoing treatment. Replenishing the sunshine vitamin treatment options. Treating vitamin D deficiency typically involves increasing vitamin D intake through a combination of lifestyle modifications and, if necessary, supplementation. Sun exposure is the most natural way to boost vitamin D levels. Spending short periods in the sun without sunscreen can significantly increase vitamin D production. However, it's crucial to avoid sunburn, as excessive sun exposure can increase the risk of skin cancer. Dietary changes can also help increase vitamin D intake. Consuming foods rich in vitamin D, such as fatty fish, egg yolks, and fortified foods, can contribute to raising vitamin D levels. Vitamin D supplements are often recommended for individuals with significant deficiencies or those who cannot achieve adequate levels through diet and sunlight alone. For individuals unable to get adequate sun exposure, UV lamps and bulbs that mimic the sun's rays can be an effective alternative to increase vitamin D levels. The price of deficiency: complications of untreated vitamin D. Deficiency. Untreated vitamin D deficiency can lead to various health complications, some of which can be serious. One of the most well-known complications is rickets, a condition that affects bone development in children. Rickets causes soft and weak bones, leading to skeletal deformities, delayed growth, and bone pain. In adults, untreated vitamin D deficiency can lead to osteomalacia, a condition characterized by softening of the bones. Osteomalacia causes bone pain, muscle weakness, and an increased risk of fractures. Vitamin D deficiency can also lead to severe health issues, including osteoporosis, weak and brittle bones, increasing the risk of fractures, especially in older adults. Cardiovascular disease. Some studies suggest a link between low vitamin D levels and an increased risk of heart disease. Autoimmune diseases. Vitamin D is thought to play a role in regulating the immune system, and deficiency has been associated with a higher risk of autoimmune diseases like multiple sclerosis and rheumatoid arthritis. Increased risk of infections. Due to its role in immune function, low levels of vitamin D may increase susceptibility to infections. The bottom line: prioritizing vitamin D for optimal health. Vitamin D plays a vital role in maintaining overall health and well-being. From supporting strong bones and a healthy immune system to potentially reducing the risk of chronic diseases, ensuring adequate vitamin D levels is essential for people of all ages. While sunlight is the most efficient source of vitamin D, factors such as geographical location, time of year, sunscreen use, and skin pigmentation can affect our ability to produce enough from sun exposure alone. Vitamin D deficiency is a widespread but often preventable condition. By understanding the causes, symptoms, and risk factors, individuals can take proactive steps to ensure they maintain adequate vitamin D levels. Remember, maintaining adequate vitamin D levels is a lifelong endeavor that requires attention and proactive measures. Thank you for watching. Don't forget to like, subscribe, and hit the bell icon for more health and wellness tips from Health Hacks. Stay healthy and youthful.